I like working with teenagers. I like that I can be honest with them, and call them on things, and I like that they push back. They're old enough to know their own mind, but young enough that they're still open to influence and able to make decisions for the rest of their lives.
I discovered during my pediatrics residency that I wasn't a huge fan of just seeing babies. I find teenagers a bit more interesting in how they're able to see the world and really experience life. And so I find it really special to be able to sit here and take care of their health and meet their needs in that way.
For me, it's a little bit personal. Like, I always find it's enjoyable to help teenagers and young adults to kind of help them become the best versions of myself, because I feel like there were a lot of difficulties me growing up. For example, there's not much of a mentor figure, so I wish someone like me was available for my patients. So that's the person I'm trying to become.
A good adolescent medicine fellow is one who is open to learning from their patients and learning from others. Adolescent medicine, by its nature, is very interdisciplinary, and so being able to work with nursing, psychology, social work, medical sociology, and other colleagues, as well as getting input from our youth, is extraordinarily important.
Adolescent medicine is a team sport. And even if you go into solo practice, you're going to be working with nurses, you're going to be working with social workers and case managers, you're going to be working with psychologists and therapists. And so our fellowship program gives you the opportunity to work in real time with other people who are training in those fields, and also with faculty who are leaders in those fields. Someone may not know that they're interested in research before joining our fellowship program, but when you're done with our fellowship program, you'll have skills in research and actually learn how much fun it is to do research, how exciting it is to answer a question that has not been answered yet. And by your own work, you are adding to the field, the scientific and medical field, that will better the health of adolescents and young adults.
The opportunities for research are diverse, and there are lots of different mentors depending on a fellow's interests. We have some who are working with eating disorders, a lot of mental health concerns. You name it, there's probably someone at IU who can help support you.
There's a lot of flexibility in terms of what you want to do. Pretty much all of us are doing a little bit different in terms of what we want to do with our career.
It's very, very much a collaborative approach and helping you guide yourself through appropriate patient care while still trying to make sure you have your own style.
Our fellows in our fellowship training program get to experience caring for people who have urban and rural backgrounds. Some people take the bus to get to our clinic, and some people drive 3 hours to come to our clinic. We care for patients where English is not their first language, or perhaps it's their first language but not their families. We care for patients whose families come from different educational backgrounds, different employment backgrounds, different educational goals for their children. And with that, you get such a rich understanding for how to care for patients and families that can be applied to a lot of different ways in which you can practice.
When I first came to visit, I definitely thought I was just going to be seeing cornfields. Turns out there's a lot of culture here, multiple pro teams. The airport is phenomenal, and you can get through it extraordinarily quickly, even without TSA pre-check. There are flights that go everywhere, and I get very mad when my 25-minute commute takes me 30.
The Midwest is my home, and these kids are my kids. And regardless of the challenges that we face these days, it's my home.